On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna. Hi, good evening, everyone, and welcome to another episode of Talking with Dr. Donna. This show has the mission of building a generational health network so that we can help to end the premature cycle of death in the Black community here in America and across the diaspora. We focus on 4 pillars of health on Talking with Dr. Donna. We focus on the mental and emotional health. We focus on spiritual health. Of course, we focus on physical health. And we also focus in on environmental health. And every Thursday at 6:30 p.m., you have an appointment with the doctor. So thank you for tuning in tonight. If this is your first time joining Talking with Dr. Donna, welcome. Thank you so much for tuning in. If you are not already a subscriber, I would really appreciate it if you would go to my YouTube channel. If you're watching this on some other channel, go to my YouTube channel, subscribe, and then hit that bell icon right next to it so that you know every time I go live. And when do we go live again? That's right. Every Thursday at 6:30 p.m., you have an appointment with the doctor, and that's Pacific Standard Time. Hopefully, you will become a part of the Generational Health Network. Tonight, we're going to talk about hypertension. February is American Heart Health Awareness Month, and we're continuing every episode this month to talk about high blood pressure. It's also Black History Month, and as you may or may not be aware, hopefully you are aware, but African Americans have a pretty high rate of high blood pressure. I always talk about generational health. And a part of the generational health is so that we start with our young children talking about what diseases are already prevalent in our family and really move to change that narrative. So in my family, we have high blood pressure. My mother had high blood pressure. I have high blood pressure, and I'm really doing my darndest to not continue that same issue for my children. So talking to them about what is high blood pressure, what can they do at their age to start thinking and building habits so that they have the right types of food and that they understand their risk so that when they're my age, we don't have to have this conversation about them having high blood pressure. And it only takes one person who makes that change within your family's genealogy. And if they make that change, they have the ability to impact for the better at least the next 4 generations. Isn't that awesome and amazing? That's worth us talking about. That's what we do here on Talking with Dr. Donna, talking about ending that cycle of premature death because of things like high blood pressure that leads to heart disease that can lead to strokes. All right. So tonight, I'm so excited because we have an amazing guest, and she's going to talk to us about high blood pressure. And more importantly, not just what is high blood pressure, but what can you do to help decrease your risks? And how can you make sure that if you have high blood pressure, you're actually checking your blood pressure the right way? It's so very important. So I'm going to bring out our guest in just a minute, but first I'm going to introduce her. So first we have tonight Leslie Brown, who is the Public Health Program Manager for the National Hypertension Control Initiative with the American Heart Association. In her role, she works as the portfolio manager. That means she's kind of, a big deal, y'all, that she takes care of hypertension and resources for the Health Resources and Services Administration and the Office of Minority Health. They're funding different centers around the state of California to really talk about high blood pressure. Leslie is committed to advancing health and promoting wellness by designing health equity strategies that focus on improving health in underserved communities. All the things we love to hear on Talking with Dr. Donna. She has over 13 years of experience in building and collaborating. I've known Leslie for a long time. We've collaborated on many, many events and things together. And I think you're going to really enjoy what she has to say tonight. She has a bachelor's of arts in family and consumer science with a concentration in food and nutrition from California State University, Sacramento, and a certificate in project management from California State University, East Bay. She lives right here in the East Bay, folks, with her family and enjoys exploring all the great Bay trails in the Bay Area. So, talking with Dr. Donna, let's give a warm welcome to our guest tonight, Leslie Brown. I'm going to bring her in. Hi, Leslie.
Hi, Dr. Carey. It's so great to see you.
Thank you. It's so great to have you here. Thank you so much for coming on tonight and really talking to us about this important topic of hypertension, particularly in the Black community. So let's start with, what is hypertension?
I'd say, for hypertension, I think it's so important for everyone to first understand, too, what is blood pressure so that they can then know what hypertension is or high blood pressure. But what is your blood pressure? And so your blood pressure is when your heart beats. It pumps blood into your vessels. And then this creates pressure against your blood vessel walls. And then the blood pressure causes the blood to flow to all parts of your body. So it's so important just to understand, what is your blood pressure? And then hypertension, high blood pressure is when your blood pressure, the force of that blood flowing through your blood vessels, is consistently too high. And so oftentimes your blood pressure is monitored in two numbers. And so it's important for people to know, everybody always sees that top number and the bottom number, and understanding, what those numbers mean. So your top number is your systolic pressure, which indicates how much pressure your blood is exerting against your artery walls when your heart beats. And an example of your top number would be 120, and they measure your top number in millimeters of mercury. And then your bottom number is your diastolic pressure, and that indicates how much pressure your blood is exerting against your artery walls while your heart is resting between beats. And so example of that would be 80. 120 over 80 is actually the normal range for blood pressure. And so I think it's so important to understand what those two top numbers are. And American Heart Association has great resources for guidelines, around those numbers and metrics, so that you can make sure to know what the healthy and unhealthy blood pressure ranges are. So I hope I've answered that question. So
You did a great job. And what I always like to kind of remind people is that top number, that systolic, if you imagine, like, this is there we go, let's do it this way. This is your artery. And if that artery is clogged with a whole lot of cholesterol or other little plaques, it's going to be hard for your blood to flow in. And so that's why makes your heart have to pump harder to get the blood to flow in through that tube. And then the bottom number, your diastolic, is that resting. So that's when your heart is just chilling out, and it shouldn't have to push up against a lot of pressure, right? Your body's pressure should be low. So if your body is pumping, if you imagine you have your heart working all the time, if it has to work super hard to push the blood out, and then it also has to work hard when it's just supposed to be chilling and resting, your heart is doing extra double work. And that's why it leads to things like heart disease, because your heart is working harder than it really needs to and should for your body. So thank you for that, Leslie. That was great. So understanding what is blood pressure, what that top number means, and what that bottom number means is extremely important. And we're in Black History Month. We know that Black people tend to have a higher rate of high blood pressure. What are the current statistics around Blacks in high blood pressure and other communities of color?
Yes, Dr. Carey. I think, specifically for Black Americans and other minority groups, we tend to have, like you said, a higher rates. And so I think it's important for everyone to know that nearly half of American adults have high blood pressure, and a lot of people are walking around and they don't even know that they have it. And so some of our latest statistics we have are that over 1 in 2 African Americans have high blood pressure. Over 1 in 3 Asian Pacific Islanders have high blood pressure. Over 1 in 3 Hispanic Latinos have high blood pressure, and over 1 in 4 American Indian Alaskan Natives have high blood pressure. And so, those numbers, are pretty high. They're pretty alarming. And so, just wanting to make sure people know about those numbers. And the best way to know that you have high blood pressure is make sure that you're checking it, and talking to your healthcare provider. So
Yeah, those are really alarming statistics. When you think 1 out of every 2 Black people has high blood pressure, that's like that is like an epidemic. I mean, that's almost like, if we walked around and said 1 out of every 2 people had COVID, we would be going crazy. We would be screaming and talking about prevention, and there'd be
yes.
all kinds of money thrown at it and prevention. And we're not hearing that same type of screaming and yelling about high blood pressure, particularly in the Black community. I kind of feel like we're a little lax about it. Like we're like, yeah, I have high blood pressure, and yeah, my auntie and my cousin and my uncle and my grandma. Like we're a little bit cavalier about it, don't you think?
I agree. I agree. And I think that's why, American Heart Association is trying to bring so much awareness to it. We've got the National Hypertension Control Initiative that's really, been hunkered down and focused in on it. Because like you said, we really needs to be at the forefront of, a lot of people's conversations.
Yeah. And so as you were talking about that, I also thought about, what we call high blood pressure, which is the silent killer, because so many people have it and don't even recognize it or know about it until they're having a stroke. So thinking of American Heart Association, I know you guys have a new campaign called Get Down with Your BP. What is that campaign about?
I love the Get Down with Your Blood Pressure campaign. It was created as we're, igniting this initiative around the National Hypertension Control Initiative. But it's actually a collaboration with the Ad Council, and it adds fun music and dance. And it's really meant to encourage adults ages 35 and up to really talk to people about self-measured blood pressure and about talking to their doctor about how to manage their blood pressure. So I really love it. I know the video, the dance is so cute. We have there's actually a social media dance. It's on our webpage where you can learn the steps to it and kind of, just really be empowered. But it talks about, making sure that you know how to take your blood pressure. So it's get it, slip it, cuff it, and check it. So it's really great. I think people love it.
Yes, well, I'm hoping that we're going to show it in this episode, and I hope that, you guys will get the dance. It's really cute. I agree, Leslie. It is really cute and catchy, which is important, right, for us to remember.
Yes.
Get it, slip it, cuff it, check it. Talk to doctor now and share it. Get it, slip it, cuff it, check it. Talk to doctor now and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it.
So
Yes. Yes.
How are we supposed to take our blood pressure? Like, what are some of the things that we should be doing when we're measuring our blood pressure? If we're
Definitely. I think this is something that is so important. A part of the initiative, we've been talking to health centers, making sure that clinic staff know how to accurately take blood pressure, and then empowering community members, patients, so that you know how to accurately take your blood pressure. I think it's so important that we know the steps. And AHA has this great curriculum that we've been talking to with health centers and community members. And the first part is all about measuring accurately, making sure you get an accurate reading. So, I think first it's important for people to know how to prepare themselves when they're getting ready to take their blood pressure. Like, it's so important. You need to make sure that you avoid caffeine, avoid smoking, avoid exercise at least 30 minutes before you take your blood pressure. Wait at least 30 minutes after you've eaten a meal to take your blood pressure. Making sure that you empty your bladder beforehand, before you take your blood pressure, and then making sure that you're kind of in a quiet space when that blood pressure reading is getting ready to be taken. And so, everything's all about positioning. You want to make sure that you're seated in a chair with support against your back, that your feet are flat on the ground, that your arm is resting at heart level, and then making sure that the cuff that is being used to take your blood pressure is on your bare arm. So I think those things are so important. I know since being a part of this work, and talking with centers, in my own doctor's appointments, I have had to politely correct some of the medical staff and trying to check my blood pressure. And I think as a patient, you have to make sure that you have courage to do that. If you know the steps and you want to make sure you get that accurate reading. When I was in the office, I had an MA. She was talking to me while I was getting my blood pressure taken. And I just politely stopped her. I said, "Can you ask me those questions when we are done?" Because I knew that was going to directly affect my reading.
Yeah.
So I think it's so important for people to make sure that, they know those steps. Prepare yourself before, and then make sure you are being positioned correctly. Either when you're at the doctor's office, or even when you're about to take your blood pressure at home.
Yeah, those are some great tips, because particularly the one with taking your blood pressure when you have on a sweater or a jacket and it's not just your bare arm. I know you don't want to do it. I know you don't want to take your clothes off or your coat off when you're in the doctor's office because it's cold, or you just don't feel like taking your clothes off. But kind of think about that when you're getting dressed to go to the doctor's. Like, if you know you're going to the doctor's, say, okay, well, maybe I should wear a button-down sweater versus a pullover sweater. Maybe I shouldn't wear a hoodie, because then I'm going to have to pull it off. So just think about what you're wearing, because it is extremely important, because the doctor is going to take that measurement. And if it's high, they're going to say, oh, you could have high blood pressure. And all it takes is 3 readings of high blood pressure to have a diagnosis of hypertension. So if all 3 of those readings were taken when you had on a sweater and they put that cuff over your arm with the jacket, that is going to elevate your blood pressure, or you just had caffeine, or you're talking while you're getting your blood pressure checked, those directly impact your diagnosis, right? And so you want accurate reading. So thank you, Leslie, for kind of giving us that, that little oomph we need to sort of advocate for ourselves as we are getting our blood pressure taken. There's also something in your campaign called Life Essential 8. Can you talk to us? What is the Life Essential 8?
I think the Life Essential 8 is so great. It's actually comprised of like 2 major areas. It's all about health behaviors and health factors. So the Life Essential 8, there are key measures for improving and maintaining our cardiovascular health. And there are 8 essential steps that will help lower heart disease, stroke, and prevent major health outcomes. And so I think a lot of people are familiar with a lot of the essential 8. Number one being diet related, making sure that we consume a healthy diet. You know,
Yes.
that's one. I know that's one thing that people struggle with. But eating a healthy diet with balance, fruits, veggies, and all of that sort. Number 2 is physical activity, finding ways to get your physical activity in. I know with pandemic, being part, a lot of people have been in the house, have been, sitting still. And so really, charging ourselves to get out there and experience, the outdoors. We are over here in the East Bay. There's so many great ways
Yes.
to get that fresh air. Number 3 is a nicotine exposure. So limiting smoking. If you smoke, stop. If you aren't smoking, don't start. So
And that's all kind of smoking, right? Not just tobacco, cigarette smoke, right? Anything
yes,
that's you're inhaling into your lungs, is included in that smoking.
yes. And number 4, sleep duration, making sure you get enough sleep. I think a lot of times we all may take get enough sleep for granted. And so it's so important to make sure that we're getting enough sleep at night, or day, or, making
Right.
sure that you get the sleep that you need. Number 5 is, weight, making sure that you're at a healthy weight and maintaining a healthy weight. And then number 6 is your cholesterol, making sure that you have good cholesterol. You're talking with your doctor about, your cholesterol numbers and making sure you're in good ranges. Um, Number 7, we talk a lot about blood sugar. So making sure that you're in a healthy range for your blood sugar so you can avoid other chronic diseases like diabetes.
Mhm.
And then the last one, the big one is blood pressure. So, making sure that you're in a healthy range for your blood pressure.
Yeah, so the American Heart Association has a quiz, right, associated with those essential 8. And I actually took the quiz and I did not like my score. I'm telling you, I was B plus, and I'm like, no, I'm an A student. Come on, Donna, get it together. So the good news is that there are changes that I can make, particularly for me around sleep, because I do not sleep enough. But you may not like your score, you may not like what you see, but you can't avoid it. You can't be afraid to look at it. So I really encourage you to go on to the American Heart Association site and take the heart health test, the quiz. And it goes over all of those 8 features. You answer questions, and then it gives you a score. So I'm going to take it again in about 3 months, and let's see if I have improved my score. As my challenge for myself. So that's great. So we've talked about what is high blood pressure, the statistics around for African Americans, how we measure our blood pressure and the importance of measuring it correctly, advocating for ourselves, and ways in which to decrease our risk factors for developing heart disease from our blood pressure. Um, is there anything else that you would like us to know about high blood pressure or how we can impact our risk for cardiovascular disease?
I would just say, Dr. Carey, I think it's just so important for people to be advocates for yourself. Having conversations with your doctor, your health, your entire healthcare team, and really, talking with them about, your blood pressure numbers. If you're concerned about your blood pressure, make sure to bring it up. When you're getting ready for your appointment. If you want to know what your blood pressure is, get yourself a blood pressure device. Like you can get those at the local drugstores. You can ask your provider to maybe get you one through your insurance. Talk to them about self-measured blood pressure programs. I know with the National Hypertension Initiative, we've been talking with federally qualified health centers who have been implementing these programs for patients. And so, if you're concerned about it, ask about those programs when you meet with, when you're at your next appointment. Don't be shy about it. I just think it's so important for people to make sure that, they advocate for themselves. And if you have high blood pressure, talk with your provider, the care team working with you on what's working best for you. If you have concerns about your medication, bring it up, like, and just talk to people about it. Talk about your BP goal and kind of, be your advocate. We've had this whole custom about, demand control to get to your goal. And so, making sure that, you advocate, you're advocating for yourself to get to that blood pressure goal. Because, we want to see everybody win. We want to see everybody with a healthy heart, because I think, our health is our wealth. We talk a lot about that. So.
Yeah, I love that. What is it? Demand control to reach your goal.
Yes, demand control. Yes.
Control. And it is important to know what your goal is, to have that conversation with your doctor. What is my blood pressure goal? And so then when you check your blood pressure at home, you'll know, well, I'm getting closer to my goal, or I'm far away from my goal. And then you know that you need to make some changes to get yourself closer to your goal. But you're not going to get closer to your goal if you don't take your medication. So I'm going to stress that you have to take your medication. And if for some reason your medications are not working for you, they make you nauseous, or some make you sick in some other way, or some of the high blood pressure medications might give you a cough that you weren't expecting. Don't just stop. Go talk to your doctor and say, are there some other medications that you can give me? We have great options for you out there now for high blood pressure, so you don't have to suffer, but you need to take your medication if you want to actually reach your goal. All right. So thank you, Leslie, so much. This was great information, a great conversation. Thank you for stopping by, talking with Dr. Donna, and sharing your knowledge with us. You are now a part of the Generational Health Network.
Thank you, Dr. Carey. It's been a pleasure to talk with you this evening.
Thank you. Thank you so much, Leslie. And we look forward to having you back to talk a little bit more about anything else you want to talk about. Thank you so much. Take care.
Thank you. Sounds good.
All right, folks. Well, that was amazing. I hope you learned a lot. I hope you took notes. And more importantly, I hope you will share what you learned with your family and your friends. Don't keep it to yourself. Don't be stingy with this information. Share it and share it, share it. So as you know, here on Talking with Dr. Donna, we always have a food of the month. And this month for February, our food is cabbage. So cabbage has lots of vitamins. It's a great green leafy vegetables, so many different ways in which you can eat it. One of my favorite recipes is cabbage soup. And I'm going to give a shout out to Kimberly Smith for reminding me about how good cabbage soup is. I made some cabbage soup with no meat, used cabbage and some potatoes with some vegetable broth, and it was delicious. So that's something that you can try this month to increase your green leafy vegetables in your diet to help not only lower your blood pressure, but lower your risk of heart disease and so many other things. All right. That's it for this episode of Talking with Dr. Donna. Thank you so much again for joining in. Remember, you can follow me on my Instagram or on Facebook and definitely give me a shout out if you have a recipe around cabbage that you want to share with the rest of Talking with Dr. Donna folks. Thank you again for keeping your appointment. You have an appointment every Thursday at 6:30 p.m. with the doctor. And make sure, if you haven't already done so, that you subscribe to my YouTube channel and make a comment and hit like if you enjoyed this episode with Leslie Brown. Thank you so much. And until we see each other, take good care of yourselves. On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with